In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
With me in the studio, with a full head of hair, is Dr. Andreas Finner. He's a hair and scalp specialist and he carries out hair transplants. Dr. Finner, welcome to In Good Shape, and we just saw you in the report. But first, to this autohemotherapy. What do you think about that?
It's a new treatment option that involves injecting your own platelets into the scalp. We don't have a lot of studies about it, but people may want to try it out if the standard treatment is not enough or if they think they want to try out something.
People are trying out everything, believe me, if it comes to hair loss. We've got a letter from Thailand. Our viewer Peter Schmidt had some visual disturbances. So he was trying some yoga exercise with a shoulder stand. It's like a headstand, but on the shoulders. And he recognized that his hair, which previously fell out, is growing back in a nice brown color. So do you think this kind of shoulder stand could actually help patients with hair loss?
It's an interesting report, but I don't think most hair loss conditions are due to a problem with the blood flow. So it's interesting, but in most patients, what I see is that the blood supply is very good, even if they are bald.
So this could work over the blood supply and making new hair grow.
That's the idea, but I don't think it's worth trying out for everybody. It's better to see a specialist and see what's going on.
And when should you exactly see a specialist? So how many hair can fall out? We say it's normal. And when should you see a specialist?
One reason would be if you would lose too much hair for a long period of time, which you usually didn't. And the other reason would be if you're thinning and if you're noticing smaller and shorter hair. The first reason could be diffuse hair loss,
right,
with many factors. The second reason could be genetic thinning.
Okay, and if you go to the doctor and he says, I will prescribe you some pills, there's standard treatment for that. So how good are pills like minoxidil and finasteride for treating hair loss?
For genetic hair loss, we have these two treatment options, but it's mostly preventive. Like you should start early and then also use it continuously for many years. Okay. And with the minoxidil lotion or foam or with the finasteride pill for men, we can mostly see that the hair loss is stabilized, so they don't lose more.
So if you don't want to take those drugs, you can go and get a hair transplant. So how is it actually done? So who's eligible for getting this treatment?
We have to look how many hair the person has in the donor area, which is usually the back of the scalp, because those hairs are not sensitive to testosterone, to the male hormone, and that's why they will always survive even in the front. So what I look at is the back of the head, like the donor hair, but also how much is needed. And if that matches, we can do it.
So, but if you take hair away from the back of the head, it's gone. So are you bald at the back of the head then?
Of course, we don't take everything. Either we take a small piece and separate the hairs under the microscope, or we take one by one, but not everything, so it's not visible in the back.
And you can just take your own hair. You can just say, my wife has great hair. I want it to be blonde anyway, so I just take the hairs of my wife?
No, you can only use your own hair because it's like a little organ which would be rejected if it would be from another person.
Dr. Finner, what are some of the causes that make hair fall out this way?
Increased shedding can be caused by operations, medications, diets, stress, or hormonal changes. So that has to be evaluated in the hair clinic.
In the hair clinic. And so if the doctor finds out one of the causes and he treats the cause, does it mean that the hair can grow back?
Yes, in most cases it will grow back after some months, unless there's also some genetic problem with the regrowth.
Okay. What about this so-called spotted baldness, where patches of hair fall out? What's the reason for that?
Yeah, this is called alopecia areata, and it's because hair roots have a misunderstanding with immune cells and fall asleep in some spots and sometimes even all over the scalp. We don't know what's causing it. It's very common in old people, young people. It has been mentioned 1,000 years ago. And in most cases, it regrows. Sometimes it doesn't, and then we have to cope with it, which is sometimes not easy.
Coping with it is not easy at all, and patients are trying lots of things, lots of different things. We got a viewer question from Munich here in Germany. Monika Wagner wants to know if taking fenugreek supplements could reduce hair falling out in stress.
Like in other things, there are small studies also about this, but it's not a really proven treatment. And I would also advise her to see a hair specialist to really see what's going on.
So go and see the doctor. But if I go to, say, a pharmacy or go into a supermarket and I find all those different kinds of shampoos, of hair oil, which say that they can prevent and even treat hair loss, is there any truth to that?
Most of them are just cosmetics. They may improve the shine and the volume of the hair, and they are not proven to really cause regrowth or thicker hair. So it's always better to focus on medications which are really tested and proven to work.
But you would do this when the hair falls out. And can you prevent hair from falling out? Say, if you've got great hair, can you prevent falling out?
If it's possible to detect early changes like small miniaturized shrinking hairs and you start the treatment early in genetic thinning, we can stop the hair loss, and most people stay the same for many years.
We have tons of letters to this topic. So if it's so important for people out there, so why isn't research finding a cure for hair loss? What's the problem?
The hair is not easy to study. It takes years to grow. It takes months to change. And also there are many changes which are due to aging of hair. And aging in general is a difficult problem still to overcome, of course. And there is a lot of research, but it takes many years.
But is there anything in the pipeline which we can wait for to treat hair loss better than we do today?
A new approach would be stem cell therapy. It involves taking good hairs, usually from the back of the scalp, then multiplicating the stem cells in a laboratory and injecting it into the scalp. But we still don't know if it really works in a long-term period.
Okay, Dr. Finner, thanks so much for being with us today in the studio. Thank you.